So currently, we treat these patients in a very similar fashion to any other patient diagnosed with stage 4 disease. Everyone should get NGS testing. Everyone should be tested for microsatellite instability. And for our young patients, I highly encourage germline testing to make sure they don't have an inherited familial syndrome, because that can impact family members and could work for prevention in the preventative aspect for them. And you also want to know if they may benefit from immune checkpoint inhibition, obviously, by checking for microsatellite instability. But currently, for our young patients, they receive the same type of therapy as our average age adult patients, just because we haven't found any unique molecular markers for these young adults. But the reality is they have different challenges. They are trying to go to work every day. They're trying to not be penalized for being away from work for so long. They're concerned about financial toxicity. They're trying to raise a family. So they have their own very unique obstacles that they have to face once they're diagnosed. And I think the best thing that any provider can do for these patients is, number one, make sure that they're receiving appropriate fertility testing, and you want to make sure if they want to have additional children. That's the most important thing before starting any therapy. Make sure they get their genetic counseling, and then really make sure that they have the support services they need in order to optimize their care, including psychosocial support, whether or not they need psych oncology or just social work, whether or not they would benefit from palliative care or supportive oncology, pain management, etc. So you need to make sure these patients have a primary care physician. Like at every aspect, you're trying to make sure everything is covered. So when they're receiving their treatment, their chemotherapy or immunotherapy or any clinical trial for that matter, they feel that they know who to turn to if they're having any potential emotional or physical setback. I think it's extremely important.